Alzheimer's disease. This disease is named after Dr. Alois Alzheimer. Alzheimer's disease is a progressive neurological disorder that affects the brain, primarily impacting memory, thinking, and behavior. Alzheimer's disease is a complex and challenging condition that affects individuals and their families in profound ways. Alzheimer's disease is one of the most common neurodegenerative diseases that cause dementia. Alzheimer's disease is a brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest task. The early symptoms of Alzheimer's disease it include mild forgetfulness, difficulty with language and problem solving, confusion, disorientation and changes in mood or behavior. As the disease progresses, individuals may experience severe memory loss, disorientation to time and place, difficulty speaking and swallowing, and eventual loss of independence. In 1906, Dr. Alzheimer noticed changes in the brain tissue of a woman who died of an unusual illness. After she died, he examined her brain and found many abnormal clumps and tangled bundle of fibers. Now they are known as plaques and tangles. These plaques and tangles in the brain are considered some of the main features of Alzheimer's disease. Another feature is the loss of connection between the nerve cells or the neurons in the brain. Many other complex brain changes are thought to play a role in this disease. This damage initially takes place in the part of brain involved in memory, including the cortex and hippocampus. It later affects areas in the cerebral cortex, such as those responsible for language, reasoning, and social behavior. Eventually, many other areas of the brain are damaged. People with Alzheimer's have trouble doing everyday things like driving a car, cooking a meal, or paying bills. They may ask the same questions over and over, get lost easily, lose things or put them in odd places, and find even simple things confusing. As the disease progresses, some people become worried, angry, or violent. Age is the greatest risk factor for developing Alzheimer's disease. Most cases occur after the age of 65. Although early onset Alzheimer's can occur in individuals in their 40s or 50s. Other risk factors include a family history of the disease, certain gene mutations, a history of head injury, cardiovascular disease, diabetes, and lifestyle factors like smoking, high blood pressure, obesity, etc. There is no single test to diagnose Alzheimer's disease. Doctors rely on medical history, physical and neurological examinations, cognitive assessments, and various laboratory tests to rule out other possible causes of symptoms. Brain imaging techniques such as MRI and PET scans may also be used to evaluate the brain's structure and function. Currently, there is no cure for Alzheimer's disease, but some medications can temporarily improve symptoms or slow down their progression in some individuals. The drugs primarily target neurotransmitters involved in memory and cognition. Non-pharmacological approaches such as cognitive stimulation, regular physical exercise, and a healthy diet may also help manage symptoms and improve overall well-being. The 5 A's to Alzheimer's diagnosis are anomia, that is inability to remember names of things. Apraxia, misuse of objects because of failure to identify them. Agnosia, inability to recognize familiar object, taste, sound, and other sensations. Amnesia, memory loss. And aphasia, inability to express oneself through speech. Alzheimer's disease require long-term care and support. As the disease progresses, individuals often require assistance with daily activities and personal care. Supportive services such as memory care facilities, home health care, and caregiver support groups, it can help improve the quality of life for both individuals with Alzheimer's and their caregivers. Early detection and intervention remain essential in managing this disease and improving the outcomes for affected individuals and their families. Hope this video has provided you with valuable insights into this condition and its effect on those affected. Remember, by raising awareness, we can strive towards a future where better treatments and prevention strategies are available. Together, we can make a difference in the lives of individuals with Alzheimer's and their families. Please like, share, and subscribe. Thank you and keep smiling.